Hello and thanks for joining us. I'm Brent Cannon. Just 3 decades ago, the life expectancy for somebody with cystic fibrosis was about 30 years. But thanks to advancements in treatment, people are living longer. The life expectancy is now extended to about 50 years. And that's why the first UCSF Fresno Cystic Fibrosis Family Education Day event is so important. It's an opportunity for anybody in the community to be introduced to the only adult cystic fibrosis, or CF, center in the Valley and learn all about the advancements in treatment.
If I didn't have doctors who were experts, a care team that were experts on all of my specific needs, I have to explain myself to other doctors, and I don't have to do that at a CF clinic.
Cystic fibrosis is a genetic disorder that causes secretions in your lungs, digestive tract, and other areas of your body, which can lead to infections and difficulty breathing.
You also have problems in your pancreas where you can't digest food properly, and also lose vitamins that can cause problems with bone health and other problems.
Dr. Paul Doe is the director of the UCSF Fresno Cystic Fibrosis Center.
We see both pediatric and adult patients. We're the only center that sees adult patients in the Central Valley.
CF used to be a disease of children. Now it is becoming a disease of an adult because people are living longer. So there's going to be an explosion of adult patients with CF. And we need to be ready to cater that demand in the Valley.
These patients can now find that support with Dr. Anil Ghimire, Associate Director at the Cystic Fibrosis Center.
So we have an adult CF center in the Valley that we are the only one in the Valley that provide that adult care.
A typical day for a CF patient is very difficult because they're required to do these breathing treatments every single day. And these breathing treatments can be sometimes between 30 minutes to an hour, and we expect them to do it twice a day. In addition to that, if they have problems with digestion, they're constantly having to take medications to help digest food with every single meal.
Abigail Treadway is an adult living with CF. She knows firsthand where treatment was and how much it's progressed to where it is now. New treatment has literally changed her life as well as extended it.
It used to be so overwhelming. Part of it is I'm so much healthier now, and there's not a whole lot I have to do to stay healthy anymore. Now I just take a couple pills and I eat right.
Besides treating patients, the center also brings several resources and experts to one location.
Having a multidisciplinary team is very important for the patients because they get to have all these cares in one single visit. It addresses multiple dimensions of a single disease. So we have these multiple specialty, subspecialty.
Patients like Abigail are fortunate to have high quality of care so close to home.
The CF Foundation right now says that you have to have at least 4 clinic visits per year. So you have to travel 4 times a year out of the Valley. That's not good for the patient to travel out of the Valley.
Otherwise, they would have to go out to either the Bay Area, up to Sacramento, or Southern California.
With these advancements, there's so much to be optimistic about for those with the disease.
I see parents will make accounts for their kids and share their stories, and they're these just happy, healthy looking children. And they're all so bubbly, and I'm like, that is just so amazing because I've never seen like chunky CF babies before, and it's such a big change.
And as for Abigail herself, she now can focus on living a longer and more fulfilling life.
I have plans for my future, and I didn't always feel prepared with those plans. I didn't always feel that I had very many options, and now the world is my oyster.